Oregon health officials are releasing new COVID-19 projections.
They also announced a joint statewide action plan to help healthcare workers treat patients with the virus. Fox 12's Brenna Kelly joins us live to share the very latest from the Oregon Health Authority. Brenna?
Well, Oregon health officials stressed how critical it is that we all follow Governor Kate Brown's aggressive social distancing measures. If you haven't been convinced yet of the consequences, we've continued to emphasize they now have enough information to show us. Right now, epidemiologists predict there are currently more than 800 COVID-19 infections in Oregon. As of today, only just over 300 have been diagnosed. Take a look at these models. They show Oregon is at a critical moment right now in its fight against COVID-19. The social distancing measures we take today could alter the trajectory of new infections. Health officials say if most everyone maintains these interventions the governor set forth, there will be an estimated 1,000 cumulative infections by May 8th. However, at the most extreme, if we're to go back to business as usual, there will be about 15,000 people who will get sick in this time period. If we do not continue with the extreme measures set in place right now, projections show the number of hospital beds needed are likely to overburden healthcare systems.
We know that without our social distancing measures in place, that the cases were going to dramatically increase in the next 2 to 3 weeks. Just because cases are increasing more slowly now, we know that those cases could increase rather quickly because of the contagion. We've seen that in other jurisdictions like New York with dramatic increases in cases day by day over the last week. And we want to make sure that we try to get to a point where we don't see that dramatic increase, that we continue to see slow increases or ideally decreases.
The governor's Joint Task Force for Healthcare Systems Response to COVID-19 developed a plan which addresses 4 actions necessary to expand capacity within hospitals and maintain the healthcare system's capability as Oregon braces for a surge in new cases. 1. Buy and distribute medical supplies, including PPE. 2. Optimize hospital capacity. 3. Mobilize the healthcare workforce. And 4. Maintain a unified, coordinated, and transparent emergency response to COVID-19. OHA officials say because the state began preparing for a pandemic years ago, agencies and healthcare providers have already begun to implement parts of this plan. And if you're looking at when those graphs end, May 8th, that date does not mean when the disease is going to peak or when we're out of the woods. Instead, health officials say that date is when they'll have some certainty that their projections are showing them what they think is going to happen. For now, reporting live in Portland, Brenna Kelly, Fox 12 Oregon.